Good afternoon. My name is April Watts with Magic 95.9, and welcome to Facebook Live. We are here today talking with Dr. Kevin Carter, family physician at GBMC. How are you today?
Doing great. Happy
Fantastic.
to be here.
Happy to have you. So, it's getting close to back to school time, and a lot of times when parents are preparing for back to school, they have these long checklists of the kids need graphic calculators, they need clothes, they need school supplies, all of this stuff. But a checkup is rarely on that. And why is it important that kids get checkups before they head back to school?
Well, there sometimes on that list, though, there is that notice from the school that says your kid's not coming unless they have this doctor form filled out. So that is there sometimes, but certainly that's usually the younger age kids. The back to school checkup is one of the most difficult questions to answer as to what exactly is it. Because when I have people ask me that, my answer is it would probably take me longer to explain everything we do than it would to just do it.
To just do it, right?
But the idea of the back-to-school checkup is really that it is the school-age version of that well-child evaluation that's been done for your kids since they were born. And obviously when they're real little, they're coming in more frequently. Once they become closer to school age or at school age, it usually is an annual visit.
Okay.
And the most broad way of explaining it is it's a chance to sit down with the doctor, make sure all of your concerns about your child have been answered, about just the random question that you may have been Googling recently. As the kids get older, a chance for them to have their own questions answered by their doctor about the concerns with growth and life and you know, whatever else may be happening. And then also really for the doctor to go through all of growth and development. You know, is your child at the place where they're expected to be? Are there any interventions which would be beneficial to help them progress in school, in life? And also the next piece of that is prevention. Everyone thinks vaccines is part of that, which is a huge portion of prevention in childhood, but also other preventative screenings, whether it's blood pressure, eye checks, vision checks. It all gets encompassed into this back to school check, which really is a well visit to cover everything that's going on with the kids.
Well, that's a really good explanation, and this is a really hot topic because we have a bajillion questions from audience members and viewers that were just interested in this topic, which is, I mean, there are a lot of parents out there, so that makes a lot of sense. So let's dig into these viewer questions. Someone asked the question, what is the difference between a family physician, a pediatrician, or an internist?
Heard that one plenty of times. So I'm a family physician.
Okay.
The most simple way of explaining it, family physician takes care of birth through the end. Pediatricians birth through kind of a different cutoff depending upon the doctor you see, but anywhere from 18 to 25 usually, the childhood years. And an internist picks up where the pediatrician finishes, so adulthood. The trainings are a little bit different. The family docs, we train for all ages during our residency training and typically spend a lot more time in the outpatient, non-hospital setting as part of our training compared to the classic pediatric or internist training. So at the end of the day, when it's coming to the well child check, your kid is going to see the pediatrician or the family physician. They're the ones that are trained, but not the internist. It sometimes changes if they get to, like, you still consider your child your college age adult.
A child.
Sometimes we'll be seeing that internist once they're getting above 18. But typically, family physician, pediatrician, see the kids, but family docs also will continue through the rest of life.
Okay. And to the viewers who are watching right now, feel free to ask your questions. I have a bajillion questions here, and we're going to get to those, but your questions are important too. So feel free just to jump right in and type your questions, and we'll get to those as well. Now, there are a lot of parents that have children who play sports. What is the difference between a sports physical and the annual back to school checkup, or are they one and the same?
The way I look at it is a well child check, a back to school check, can include a sports physical.
Okay.
A sports physical by itself is not necessarily a back to school check.
Okay.
So what I mean in that is that for the sports physical, there are certain things that we want to make sure a child does not have symptoms of, does not have a family history of, does not have a personal history of.
Like heart problems or something like that.
Exactly,
Yeah.
heart problems, certain types of murmurs, abnormal heart rhythms, in some cases, some rare conditions, anatomic problems. Maybe you're missing one of this, and it wouldn't be safe to play a contact sport. And in that sports physical, it's a chance to clear them for sports. Are you safe to participate? And there are some doctors out there, some sports medicine specialists, who will actually do those visits independently if, for whatever reason, you need that done. And some schools even have agreements with different sports medicine facilities to do that. But as a whole, your primary care doctor, your pediatrician, your family doc can do that, and usually as part of that well child check. There's a few extra things we'll do on the exam, a few extra questions that we will ask, and that's really all that it takes.
And that'll save the parents money and time and gas and all that stuff, right?
One thing that I try to always at least remind my parents when they come in is let me know if your child is going to be playing sports this year, because even if they're playing in the spring, we can usually get through everything we need to for that clearance for the year at that visit, because if I don't cover the certain things which I need to feel I have done appropriately to really screen them if they're safe for sports, I'm going to have you come back.
Right.
So to avoid that second visit, make sure you're clear with your doctor that, hey, my kid might be playing sports. Can we just cover anything extra that would need to be done for the year?
So communication is key.
Oh, yes.
Communication is key.
If we don't hear it, we don't know it, right? That's the rule in life, right? If you don't say it, we don't know it.
Yes, this is true. Now, there's another question. Why does my child need a yearly checkup if they have no problems? And that's a really good question, especially for the African American community, because a lot of times we tend to not even want to go to the doctor or the hospital until it's time to go to the emergency room. Like, I have half an arm, so now it's time to go see the doctor. So why is it important if you don't notice any problems or any symptoms?
Prevention. I mean, that's the key. Make an intervention, make a change before that arm's falling off.
Right.
Before there's any more life-threatening conditions going on. We're talking well child checks as the family doc. I'm making that plug for all ages, though, too.
Yes, it's why very important.
No matter if your parents no longer taking you still need to go.
Yes.
But it's for that reason of prevention. So it's a chance for things like that vision check the blood pressure, check your weight.
Yes.
Let's make some interventions so we can prevent progression to needing medicines, diabetes, and that's the big difference there. Yeah, there's a lot of people who say, I don't want to go. The kids who say, why do I have to go? I feel fine. But that's when a lot of times you have more time to talk about those concerns that maybe they think don't really matter. You know, I've had this runny nose for 3 months.
Maybe that's a problem.
Right. Well, maybe it's not affecting life, but maybe I can make the runny nose go away.
Exactly.
Maybe we can avoid those triggers. And especially going into the school year, you say, I'm fine. But when's the last time you talked to your doctor about what your grades are? Your parents may say, oh, that's good enough. But if I say, why are you getting all B's and C's? You seem like you could do a little better. And you start picking up symptoms of ADHD. Could we make some interventions there? Oh, you're being bullied at school? That's affecting your performance? Mom, Dad, did you even know about this? That's when you can make those interventions and really try to make a difference to improve the rest of the year, improve the school year, improve life.
Yeah. If you're just tuning in, I am talking with Dr. Kevin Carter of GBMC, and we're talking about back to school and what to expect and what you need to do to prepare health-wise for your children as they begin to head back to school. We have another question from a viewer. What are some of the ways I can convince my child to cooperate more if he or she hates going or is afraid of the doctor?
That's a tough one. That's tough. I feel like from the beginning, it's that awful word, shots, right? Kids have that early memory when they're getting all those vaccines when they're young of, oh, that hurt. I don't want to go back for that. One thing to reassure your child of, you don't get a shot at every visit. It's not.
This is true.
But when you're young and you're less than 5 especially, and you just correlate everything about going to the doctor with, I'm going to the doctor, something's going in my arm, it's going to hurt. Something's going to my leg. But that's not the case. The other fear of going to the doctor may be something that the parents even may have instilled in that child. If at home you're talking about, oh, I got to go to my doctor's appointment. Lead by example. They're going to reflect what you give back. So if there's issues where your son or daughter is just really concerned about going, one step which hopefully you can make happen is to have one consistent provider. The idea of having a doctor that you can stick with from birth until they're, family
like a family physician.
Until the rest of life.
Yes.
It allows a child to be comfortable with that person. It's a familiar face. You may see an aunt and uncle across the country once a year or less. You see your doctor the same time frame. Well, you can say, oh, look, you've seen them more than you've even seen your aunt, and you're not scared of them.
Exactly.
And they become more comfortable in that way. They get to know that you're there to help them. You're not just this random person that they're put in front of once. So having a consistent relationship with your doctor is good. Even if you're going to the same practice, trying to request to see the same person in that practice whenever possible. Scheduling far enough in advance is key on that one to make sure we have appointments available to see your doctor.
That makes sense.
But that can help. So the consistency, prepping them beforehand, letting your kids know what to be expected. If you don't know what to expect, that can always be a phone call ahead, like, hey, what should I tell my child is going to happen at the visit, so you can prepare them. Any child that's prepared is going to go into any situation better.
Yes.
No one likes the unknown, child or adult.
Yes.
That's a few things to help.
And if all else fails, bribery always works. No, I'm joking. Just joking. Alrighty, so let's move to a somewhat controversial topic, vaccines. There are people who are pro-vaccine. There are people who are anti-vaccinations. And we have a lot of questions about that. One of the questions that we have here, there are more vaccines now than when I was a child. Is this dangerous? And that's a very good question. Yeah.
Quick, easy answer. No. No. Vaccines are a way to prevent disease. It's always a good conversation to have with your doctor from the beginning that you meet with them. Why do I get vaccines? What's the purpose? The purpose is to prevent illness. Illnesses that can be fatal. We have vaccines to prevent that. And people say, yeah, but how often does that happen? Not very often, because people are vaccinated against these things. But when you're seeing increased, rates of, especially measles, we've seen popping up more as there's been more population that maybe isn't getting vaccinated. It's about prevention. Now, we've advanced in medical life, in knowledge. Think about people 50 years ago. You're so limited, even antibiotics. The age that people died was much earlier. And that's because we've had advancements. So why are there more vaccines? Because we've been able to develop more. The vaccines that your child gets have gone through such intense research and trials to prove safety that nothing's going to be on the standard recommended schedule that isn't proven to be safe. So why are there more? Because we know more. What you'll find is that a lot of the vaccines today are considered safer even than the ones that you may have gotten. Been able to figure out what levels of the particles of viruses, bacteria are really needed, so it's not as high of a dose. It's not as much of a actual substance being injected. So if anything, things are safer. So dangerous? No.
All right. Desiree wants to know, are there any new vaccines for teenagers around 17 years old going back to high school this year? And will there be any additional vaccines for college?
There's one vaccine that's probably the newest on the standard recommended vaccine schedule, and it's a new meningitis vaccine.
That's important.
Yeah. So
I was watching the news, and a girl lost her feet because of it or something. Yeah, it was really sad.
And this is talking about bacterial meningitis. There's different types of meningitis, but specifically bacterial meningitis is the life-threatening, very severe infection that can occur. There's been a meningitis vaccine for many years now. But there's different types of the bacteria that causes meningitis. And there's one group of those bacteria that they've created this new vaccine for, what's called serogroup B. All you need to know is, hey doc, I heard there's this new meningitis vaccine. Should my child get that? Now, The traditional meningitis vaccine is recommended for most children to get at age 11 and age 16, and it's required to live on campus at most colleges.
Okay.
The reason why is meningitis, though not a very common infection that's seen, is extremely contagious. So if you have a bunch of people that are living in close quarters, like a college dorm, shared bathrooms, roommates, tight hallways, tons of people, there's a much higher risk for spread of disease.
Right.
And for that reason, most colleges require it. The new vaccine for the group B meningitis is not on the actual required, absolute recommended. It's still considered an optional vaccine. And that's why a discussion with your doctor is important. There are some colleges now in the United States which are requiring it for admission. And what you've seen is there's been a few cases of this strain of meningitis. Those are the schools that are saying, okay,
yeah,
you want to have this too.
Yeah.
Again, prevention. It's not a common thing, but if it's seen, can be extremely life-threatening. We're talking an infection that is much more serious than your typical pneumonia.
Right, yeah.
Ear infections, sore throats, stuff people are thinking, no, this is a life-threatening infection, so important to consider. But again, talk with your doctor. If your child especially is going into college, going into the military, something to really consider.
Okay, we're going to interject with some viewer questions,
Wonderful.
but I want to squeeze this one in really, really quickly because it relates to what we were just talking about. There are definitely more vaccines now, even though they are safer. But is it safer to spread out getting the vaccines, or do you just go and get them all at once, like shoot me up, pump me up with everything, so I'm good and I can walk away? How does that work?
We actually have a set vaccine schedule, which is what has been tested and trialed. And if you want to do things in a way that is considered to be the most safe, the way that we know that it has been trialed and tested, it's with combinations of vaccines.
Okay.
There's actually quite a few vaccines which are combined into one. So especially in early childhood, your very young children, just less than a year old, we have vaccines that combine 3 into 1.
Okay.
So that's how we've been able to expand what we can cover without giving that many more shots. But sometimes people have concerns like, oh, I don't know if I want them to get all those at once. Well, I would say we have more data on the combinations than we do on individual ones all spread out.
Okay.
And you're also looking at putting your child through more discomfort, more potential side effects, because they have to get so many more. So in that case, I'd say no. From what we know and what has actually been tested, certainly I would say try to stick by the schedule of the combinations. Yeah, without a doubt.
Okay, you ready for these viewer
Let's
comments
do it.
and questions?
Okay, we have a question from Greg, and he wants to know, are there kids that have allergies to certain vaccines? We know that some people have bad reactions to flu shots. We're wondering about other vaccines.
Allergies related to vaccines are more commonly associated with how they're made and the other components in them. So the most common one we hear about with the flu vaccine is a allergy to eggs. So the flu vaccine, in a way to mass produce as fast as possible, in the most traditional way, is made with eggs. If you're allergic to eggs, it's a conversation with your doctor. There are safe ways to still deliver the flu shot, even if you're allergic to eggs.
Okay.
And sometimes there's even alternatives to use. In terms of allergy to other vaccines, there have been some trials looking at what is the true rate. And for the general population, a anaphylactic, a life-threatening allergy to a vaccine is extremely rare. I'm talking like 1 in hundreds of thousands.
Okay.
Extremely rare. It's much more common to have a local, what we call a site reaction. You're putting a needle into the skin, into the muscle. Sometimes you get a little redness, a little soreness. But in terms of having a true life-threatening allergy, very, very, very uncommon.
Okay. Do we have any more?
We don't have another question, but people are really loving your
awesome.
Great.
Facebook Live.
Thank you for watching.
And Miss Queen T said great information. So we have some great viewers. So
Wonderful.
Good stuff. So we have another question which I'm very interested in because, again, I'm speaking from the African American community. We have been taught to be somewhat skeptical about medicine, especially vaccines, and we think people are trying to do tests on us and all sorts of stuff. Do vaccines cause autism?
I love answering this one. No.
It's real simple. No.
No.
Okay.
No. Talk about one of the hottest topics in vaccines in the past probably 10 years. And a lot of it goes back to this research that was done years ago that was shown to be completely false, misproven, wrong, retracted. So the answer is no. There's no evidence that vaccines contribute to autism.
Alrighty.
Yeah.
So what are the most common side effects of vaccines besides like the muscle situation?
That is the most common
side effect. Okay.
So most common side effects at the location: soreness, redness, sometimes if there's the muscle, especially if kids, if they tighten up when they're going to get that vaccine, you can sometimes get a little bit of muscle swelling afterwards, maybe a little bump there. Things that parents should always look for at home, and probably the most common thing we see, your kid's just a little tired or a little fussy if they're younger. That's because the way vaccines work. So the purpose of a vaccine is to introduce an inactivated, unable to infect you form of the virus, of the bacteria. Your immune system starts working. It says, hey, look at this thing. I need to make antibodies. I need to make sure that if I ever become exposed to this in the future, I can fight it off. When your immune system cranks up, you're using energy.
So it makes you tired.
Yeah. So what I like to tell people is, don't be surprised if you feel like you're coming down with something, but you never actually get sick. You just feel like, oh, I could just lounge on the couch a little bit. Or your child is doing the same thing. Like, can we just stay in tonight? That kind of thing. Very common.
I'm so excited about this. I know this is for the viewers, but I'm getting so much out of this.
Great.
I cannot tell you, I've not had a flu shot since I was a kid. Because the whole concept, I was like, well, why do they need to infect me with the flu so I won't get the flu? No, thanks. I just don't want the flu at all. I don't want it in me. So I am learning a lot. Thank you so much, Dr. Carter.
I had this conversation today with a patient who has never gotten a flu shot, and now they're convinced. So let me just give you my version of the flu shot, right? So, yes. What's true out there, the flu shot is not 100% effective in preventing you from getting the flu. It's not. If anyone tells you, they're lying. But the flu is a virus that changes. We have different strains that we see. Through the years, it changes. So every year, there is a new flu shot developed that is developed to cover the most common strains that are predicted to be present in the upcoming season. Usually there's four strains that you get. It's impossible to make you sick because there's nothing alive in it. It's just the particles that let you form the immunity. But then the more people that are vaccinated, the less people have a chance of getting it and spreading it. And the average healthy young person, adult, will likely, if they get the flu, they're going to feel bad. They'll be sick for a week, might have to miss some class, some work. But the real danger is for those that have weakened immune systems. Those little babies. We don't vaccinate most babies until 6 months of age. It's not recommended till then. The elderly population, who are already more susceptible to disease, I don't want you to be in the grocery store and be the day before you show symptoms and potentially spread it to these people that it could be life-threatening. They could end up in the hospital. So the more that are vaccinated, the less spread you can actually get.
Aren't there some people that have certain illnesses that if they get the flu, that it's almost deadly for them?
Yeah, I hate to use the word, it's almost deadly, but certainly far more complications. Anybody with respiratory problems. So if you have asthma, if you're an older person, and you have COPD, and you come down with a respiratory illness like the flu, you are set up for being at much higher risk for a bad asthma exacerbation.
Right, and you don't want that.
Exactly. Older adults, someone who has chronic lung disease certainly can also be at high risk for developing a pneumonia from the flu.
Which is not good.
Yeah. So definitely it's all about prevention with that one.
We don't want that, but we do want more questions from the viewers.
We just got 3 great questions. One from Vanessa. She said, what are your thoughts on the HPV vaccine for older kids?
Okay. Well, I think that should be expanded, though. Thoughts on the HPV vaccine for all kids. So the HPV vaccine, if you follow by the standard schedule, is typically given starting at age 11 for boys and girls. It's actually been approved to start as early as age 9.
Wow.
The HPV vaccine, the purpose of it is really to help prevent cervical cancer and genital warts.
Okay.
I like to think of it as one of the few vaccines, preventive interventions we have to help prevent a cancer.
A cancer.
It's huge. And the vaccine has been in continuous development through the years that now it covers against 9, the most common one that's used now, it covers against 9 strains of that virus. Because again, there's different strains, some more aggressive than others. And why is it recommended for boys and girls? Because it's a sexually transmitted infection.
Yeah.
So the more people that are covered, the less risk of those issues occurring for men and women, boys and girls. It's now been shown that it doesn't even need to be 3 shots anymore. In some cases, if you talk to your doctor, if you started at a certain age, it can just be a 2 vaccine series. But again, it is like all the other vaccines that are given. It has been tested, trialed, shown to be safe. Don't think of it different than the other shots that are given in the vaccine series. And because it's one of the newer ones, I feel like anything new that comes out, people are hesitant to.
Yeah, yeah.
Oh,
people are resistant to change and the unknown.
Whether it's a vaccine or a new type of food or a new way to tie your shoes, I mean, anything, it's a change. You don't like change, and it's scary, especially when it's related to your medical health and something that's being injected into you. But that's why it's important to talk to your doctor about these things. Don't just think and say, I don't know about that. Talk to your medical professional.
Make an educated decision.
Absolutely. You can still say no if you want. I look at myself as an advisor.
Right.
You're the decision maker.
Right.
You got to make the decision that's right for you, but at least get the information from someone you know and trust.
Yeah. Have another question?
Yeah, we have a question from Laura. Why would some vaccines be optional when others are required?
Good question. Good question. It has to do really with how much use it's had, how long it's been out, and then longer outcome research. So something's been out for a long time. We see, yes, we're seeing greater rates of prevention. Then it ends up being expanded onto the standard schedule.
Okay.
There's really, that word optional is how I have to look at it, because I say I've got this recommended vaccine schedule from the CDC and their immunization practice board. And there are ones that are thought to be, well, you can start this a little earlier if you want. It's been tested, but this is the age we absolutely require. And that exists for some vaccines. You can start a little earlier. Most insurance companies will cover it earlier, but this is the standard schedule.
Okay.
And for something new like the new meningitis vaccine, it's exactly that. Like, do we need to vaccinate everybody at this point? Have we seen high enough rates to really support that? Well, I wouldn't be surprised if in the next few years it does become part of the standard schedule, because we are seeing it.
Okay.
Vanessa had another really great question. What are the standards for depression screening, and what age did they start doing it?
Absolutely.
Is it different for boys and girls? And also the final part of that question is, do you take raging hormones into consideration?
Great job, Vanessa. Vanessa needs to be sitting right here. She's asking really good questions.
Yeah. Mental health screening is very important in childhood. And it changes based on the age of the person you're talking to. If you're talking to a kindergartner, a first grader, you have to think about, are they going to understand the concepts truly of, are you depressed? But the questions change, so it becomes more, feelings of sadness all the time, any kind of behaviors that are seen at home and in school, which could be concerning. And that's especially where we even bring up things like bullying in the younger age groups. As children age, there are standard places in the well child visits based on age that we do provide that type of screening, especially in our adolescents. Very, very important. But so I look at it as that way, as the questions may change. Your doctor may actually be screening your child for symptoms of depression, symptoms of anxiety, even when they're younger, just in different ways that are maybe even a little hidden to you because they're asking in other ways. But yes, it is part of the routine screening that's done in the child visits, without a doubt. So we can intervene and try to help earlier than there's a major problem.
And to add on to that, how do you know when the child maybe just needs someone to talk to versus them needing to be medicated? Because from my personal perspective, I just think that a lot of children are just over medicated. Like it's easier to medicate a child than to raise a child. So how do you know when it's time to medicate?
Skill. Education.
Yes.
I hate to put it that way.
Right.
But what we know about the management of common mental and behavioral health problems in children, probably the biggest ones that stand out to everyone, especially with medication, is ADHD.
Yes.
And also certainly with depression and anxiety. We know that depending on that child, yes, some people only need some counseling, meeting with a therapist, even sometimes just school interventions, changing the setup of a classroom. And there are some children, you make all those modifications, you say, oh, we still need a little extra help from the medications, and including in depression and anxiety, there's good evidence to support that in many cases, the addition of counseling or therapy with medication can improve outcomes.
Okay.
So there are certainly situations where one or the other or both are totally appropriate. And we use a lot of screening tools. It's not just a willy-nilly, oh, Johnny's acting up.
He's a little hyper. Let's
take this.
Yeah.
No, I mean there's a lot of screening tools that your doctors will use. I like to use some screening tools where I will give some to the parents to take home and really just observe and fill out some questions, and also give one to the teachers at the school so that you get the information.
They spend a lot of time with the kids, probably more time than the parents.
And sometimes you see very similar responses, and we say, "Oh, it all matches up." Sometimes you'll see, "Wow, he's an angel at school," but at home is where we're seeing all of this. And that's that's our chance to dig a little deeper
and see what's going on at home.
Exactly. Let's figure out. Or it's the opposite. The teachers are saying all of this is happening, but at home, like, this isn't my kid.
Right.
What's happening here? But that's why it's not just he seems hyper. Here, take this. Oh, good, you seem sad. Good. Take this. No, it really needs to be something that you discuss with your physician, that you do some further testing. Sometimes it requires actual psychological testing where your child has to sit down and for a couple hours of testing with a psychologist, but not always. A lot of times these types of problems are totally handled well by the pediatrician, by the family physician. You just got to bring them up.
Okay. Yeah. And you can continue bringing up more questions.
Absolutely.
I just want to share real quick a couple of comments that came in. Courtney said, Dr. Carter is awesome. I know Courtney, so she must be one of your patients, maybe? I don't know. And also, Stell said she thinks foods can make a difference, sometimes with behavior.
Yeah, absolutely.
That might also make a difference. So, but people can continue to pose questions.
Great.
Yes. So. And we have a good question here. Other than making sure my child is updated with immunizations, what else should I make sure I ask her pediatrician about to prevent her from getting sick at school?
The unasked question is the only one that's bad, right? So how to prevent them from getting sick at school, I heard that at the end of that. Probably the single most important thing to prevent spread of infections, because that's what people really are worrying about. I don't want my kid to catch that cold, to catch the pink eye. Hand washing. Teaching your children good hand washing, even when they're not with you. So when they're out in public, that is probably the best way for your children to avoid getting sick at school. Hand washing, not sharing everything with everyone, especially like their drinks, have a bite of this, have a bite of that, but hand washing without a doubt. Different schools have policies. Some places will allow kids to carry hand sanitizers with them. Other times it's no, you can't do that, and you just rely on going to the bathroom. But certainly, absolutely, keep the hand washing going.
Here's a really good one, especially for working parents and parents that don't necessarily have child care and daycare and things of that nature. When should I keep my child home from school due to illness?
After you talk to your doctor. There are certainly a lot of situations where parents just want to do what's right for their child. And usually the answer is err on the side of caution. If you think that your child being in school is not going to help them in any way, if anything, you're looking at them and saying, you can barely sit up at the table this morning for breakfast. I mean, how are you going to be able to stay up in class?
Yeah.
But certainly talk with your doctor. If you're concerned that your child is sick enough to not be able to go to school, sometimes that's good to just make a call. Here's what's going on. Do you think I need to come in? Do you have any recommendations for me? Certainly, if your child is to the point where they're not eating and drinking, they're lethargic, they don't want to get out of bed because they truly are that weak, you need to get them checked out. But in terms of, especially after you see the doctor, when can they go back? Get that guidance from your doctor. There are certain medical conditions and illnesses that are more contagious than others. Some, the second we start treatment, you're safe to go back.
Right.
Even if you look bad, you might be safe to go back.
Go to school.
Yeah. The doctor said it's okay. You know, I one that comes up a lot are the GI bugs. You know, vomiting, diarrhea.
Right. A
lot of those illnesses are highly contagious from what's coming out.
Right.
So until that's resolving, good idea to stay home. Also for the workplace, for the adults out there. But when it comes to the upper respiratory infections, look, really base it on your parental inclinations, but also a lot of times that's when you got to talk to your doctor to figure out what's safe.
Well, Dr. Carter, this has been so informative, so fun.
Absolutely.
And we're unfortunately going to have to wrap things up, but I want you to give people like the one main takeaway you want people to walk away with from this conversation. We've covered a lot of ground, but if you could pick one main takeaway, what would you want to say to the people watching?
Well,
one or maybe two.
I'm going with two.
You can use two.
In primary care, prevention is in single-handedly the most important thing. We want to try to prevent the problem before it is that problem that's going to affect all other parts of life. And the only way to do that is to see your doctor, to not hide from us. The annual checkup, the back-to-school check, the well-child physical, call it what you may, for the kids is the time to make sure that happens so that we can help you get your kids up to date on vaccines, on screening testing to prevent problems. And the other piece, ask questions. If you think it, ask it. There are, the old line everybody hears, there's no dumb questions.
Right.
The only bad question is the one that's not asked. Ask questions. Be informed. Talk to your physician. Talk to your healthcare provider. Don't just rely on, what you've read, what you've heard from so-and-so. Talk to the person that you know and trust. And that should be your child's pediatrician, family doc, other provider. Do that. It's been fun.
Dr. Kevin Carter from GBMC reminding you as you head back to school with your children, prevention and communication are key. We'll see you next month with Magic 95.9.